effective choice of therapy for your child. First of all, we are all at the physiotherapy, always we are practicing a different approach aiming to improve the functional ability of the child and to make him independent as much as we can. And this is the only advantage of any kind of therapy, just to improve the functional abilities of any child and to stimulate the brain to do and to teach first and to do a new movement, depending on the non-damaged brain cell and the neural plasticity of the same brain. And of course, as long as you start early, you will get the best of your child according to his brain injury and his overall abilities. What we are do during the CME that we provoke the maximum functional improvement of the child through specific handling, like what Liliana told us about the distal handling, through different exercise to experience the child to different sensation, a new environmental situation, and provoking his natural movement. And actually, the next couple of questions are a bit tricky. So let's take it step by step. Okay, just a second. Yes, okay. And the question is, should we make other therapy or practice other therapy at the same time with CME or not? We have two scenarios in this. The first, if the child is looking for a regular physiotherapy program. And the second is if he is looking for an intensive CME camp. If he is looking for an intensive CME camp, as we discussed, we prefer to give him 2 sessions per day with at least 4 hours in between, so it would be very stressful and exhausted for the child to practice something else. But if he is looking for a regular physiotherapy program, so I think we can integrate other therapy with him, but it depends on the needs of every child. And the second question is, if CME exercise increase the tone and the hypertonicity or not? Well, let's ask ourselves first, what is hypertonicity and how does it happen? Simply, and out of all the integration or everything related to the neuro, simply hypertonia is a continuous signal travel from the brain to the nerves, asking the muscle to contract. And hypertonia happens when the region in the brain or on the spinal cord that control this tone get damaged by the injury. So the fact is we cannot change this tone or this hypertonia, but our rule of rehabilitation and what is our goal is to work on the antagonist muscle and the agonist muscle and the anti-gravity muscle to compete against and to overcome this hypertonia, to help the child to complete his function. And this is what we actually doing during our CME session. We work on the postural control and the anti-gravity muscle to help to put some strength in this muscle to control over the hypertonicity, and at the end it will come out with functional abilities and better participation from the child in his environment. And the last question is, should we use orthoses during CME session or not? Okay, let's take it step by step. What is the general idea from orthotics? It's basically to protect or to correct or to compensate for any deformity due to maybe hypertonicity or hypertonia or due to muscle weakness. And what is highlighted recently in the research that we should practice and do some exercise out of the orthoses. Why? Because at the end, it's a kind of support. So in the future, it will make further weakness in this muscle because basically the muscle will depend on this external support. And this is actually what we think during our CME session. We try to help and to build strength in this muscle just to keep the muscle healthy as much as we can. So we can use this strength again into a functional environmental participation. And this is what the last question. Thank you.
So, well, this is our presentation. Now we would like to take this time to listen your questions, read your questions. If anyone wants to ask something, this is the time. We are here to answer all your questions, and we are going to give some time. We just have here one questions about one of our therapists. Apparently someone, Berg, didn't understood. Berg, if you are still here with us and want to ask something, you can do it right now. So apparently there is no question for us. We're going to wait for a couple of minutes before we finish our presentation. So if there are any questions, you can write it on the comments and we'll be very glad to answer your questions.
Or maybe later. Oh, sorry. Or maybe later, if you remember any of your question, you can send it to us through our email at home.
Someone has raised the hand. Okay.
Can I ask a question?
Oh. Okay, I want to
ask one question, please.
So, Mohammed Mir is
Yes.
raising the hand. So, yeah, please.
Yes. First, thank you for all information. We have all great useful. Thank you. My question is about manage hypertonia. In the case of hypertonia, you said that try to strengthen antagonist muscles to overcome the hypertonia. This is something enough to overcome the hypertonia without any surgery or any intervention, medical intervention?
Mohammed, are you a therapist or are you a parent?
Yeah. Yes.
You are a therapist, right?
Yeah.
Well, for sure, as you know, I'm going to just give you a briefly answer, and then Mustafa can clarify any other of your doubts.
Yes.
As you know, as therapists, we are not able, the recent or the latest researches has proved that we as therapists are not able to influence muscular tone by yourself or by exercises. What we are doing is uh, to use medicines or Botox or any other kind of medical intervention to affect the muscle tone. And in that moment, after the medication or during the medication, we are trying to, and this is not only with CME, this is CME and any other technique. What we aim is to improve the functioning of the antagonist muscles in order to try to balance the functioning. But as we already know, the science already proved that we are not able by affecting muscle tone with exercise. So now Mustafa is going to clarify your questions.
Hi, Dr. Mohammed.
Hi, Doctor.
Actually, Liliana covered everything, but what I need to mention that in the spasticity or the hypertonia, we have some degree that we can manage it with conservative treatment, like what we call conservative treatment, and we have some kind of spasticity and hypertonia that really need external intervention, even Botox, even surgical intervention, or whatever. So, if you have the manageable part of this hypertonia, you can manage it with CME or with whatever NDT purpose or whatever the approach that you will use. And this is will only depending on your exercise, your kind of handling. So the critical factor here is the exercise that you will choose in the CME, okay, to overcome or to work against this hypertonia. I hope that you will get my point.
Okay, okay.
Okay.
Sorry, I have another question. Can I?
Of course, yes.
Thank you. In the point of CME, a CME approach can be applied for all cases delayed milestone, or all it will stop at some cases. I asked about a criteria to select the patient. Is there a criteria, specific criteria to select the patient that need CME and CME will be optimum for it?
Of course, we have like criteria, but again, if, of course, you are familiar with GMFCS level, okay? And
Yes.
when it comes to different level, when it comes to a case with severe muscular impairment,
Yes.
you will not find any approach will work enough to get your maximum beyond his GMFCS level. But also in CME, it depends on your level of experience and the level of practice that will help you to manage more case and to choose more exercise will be fit to different impairment. Like for example, if you are working for head control, for trunk control, for sitting, for standing, this is the main thing that we are usually working on the domain of the activity, just to put all this activity into a participation. We have different exercise for this area and we can manage them. And I think iSchool can explain more for you.
Okay, thanks.
Okay. as Isabel was mentioning, we have like we can treat all the continue with the question of Mohammed, sorry. As Mustafa will explain it, we can treat all the diseases unless they are degenerative disease. And as Isabel well said during the presentation, we, as any other therapy, depend on the capacity of the child to achieve. If we have child with severe damage, of course, what we are going to achieve is different if we are treating a child with a less severe like a severe case. Okay, so it's going to depend, as in any other therapy. So moving on, Mohammed, if there is any other question, well, we are going to pass to another question that we have here from Hala M. She's asking us, sometimes while I am watching videos about CME, I notice that they are wearing gloves or using blankets to help the kids to change the position. Can I know why? I will give my half of the answer, and Mustafa will answer the last part. I will talk about the gloves, and Mustafa is going to talk about the blankets if you want. Are you okay with that, Mustafa?
Yes.
Okay. So about the gloves, mainly the gloves are for us, for the therapists. It's not causing any effect on the children. It's for us to have a better grip and a better holding. This is going to protect our hands, protect our joints, and help us to hold better. So it's mainly for us, and some of the therapists are not using it because they don't feel that they need it. This is like a kind of a preference of each therapist. It's just going to help you to have a better control, a better grip, and reducing the stress on your joints while you're holding. And I assuming that when you're talking about blankets, you're talking about something that we call esmatas, which is an anti-grip. So I will leave you with Mustafa. He's going to talk to you about that.
Regarding the blankets or the shimata, I don't know if you are Hala physiotherapist or not, but you can simply say that it's a tool. Like in the normal physiotherapy, we use blocks, different blocks, roll and wedge. Could be one of our tools that we can use it during different exercise. And also we can use it to prevent the boxes to be sliding over each other. So as long as you are physiotherapist, I assume that you are physiotherapist, you will know that maybe if you will interested more in the CME and you will take CME course, you will know how to use this shimata. Yes, you are. I assume that. So as long as you will go more and you will take more information about the CME from someone who's CME level 4, you will know how to use this shimata in different exercise. Thank you. Anyone had any other question?
So thank you so much, Hala, for your question, and thank you also to Mohammed. We have another question. It's about what's the difference between using a swing and doing CME exercises. I think Isabel is the best one to answer this question since she is also certificate in sensory integration.
What is the difference between using a swing and doing CME exercise? This question is common. Patients' family ask me in past every time. Actually, I want to explain this difference. Therapeutic swings offer vestibular stimulation to individuals with sensory processing disorders and other special needs. The gentle back and forth motion of swimming suits improves balance and develops important motor skills. Swimming is different. Vestibular stimulation was effective in improvement, postural control, movement, emotional well-being, and social participation of a child with brain damage. While doing vestibular system studies on swimming, it's not your main goal for the child's move against the gravity. While working here, you use the vestibular system while determining the missing motor skills of the child and working on this. In CME therapy, the main goals are provoking the child against the gravity by providing distance supports. For example, in the lotus exercise, you provide a distance support with your grip and try to provoke the child by maintaining the sitting position against the gravity, the child who can sit independently. The civic and the sensor integration and the CME is the different area each other. CME, yes, okay, use the vestibular system and they use proprioceptive system, but CME wants to provoke the other motor skills. CME use distance for CME use vestibular system, but CME wants to provoke the gross motor skills, and this difference. Thank you.
So a lot of people is asking about the presentation and the written content of our presentation. We are not going to send it particularly to each of you, but we are going to upload the complete webinar in our YouTube channel, so you will be able to go there and review everything we said, and you will be able to write everything you need. Okay, so we are receiving another question from Berg Erika Pesci. So sorry, so sorry, Berg. My first language is Spanish, so there are some names that I can't understand. What types of disabilities does CME work best? Oh, we actually answered this during the questions, during the presentation. We can work with any disability, with any motor disability. Remember that CME is also another physiotherapy technique. We work with cerebral palsy, hypotonia, any genetic disorder, mainly any condition affecting the motor development or the motor function. The only and actually, it's not a contraindication; it's a precaution that we have when we are treating non-degenerative diseases. Sorry, degenerative diseases. That's when we have to assess the child and decide if this is the best technique, because we are, as you know, we are working a lot, and if we are exposing too much or making too much exercises in a degenerative disease, we can cause a damage. So I don't know if you guys want to add something to this question. Okay, so I think we're running out of time. So if anyone has, we can ask one more question. Okay, thank you so much. Oh, we are so glad that you were able to join us, and well, thank you so much. We hope that you enjoy and learn a little bit about what CME is. I'm leaving you with my co-workers, Mustafa and Isaac, so you can say bye-bye. Bye-bye, it was nice to see you. Say bye. Say bye.